This video shows a stomach containing ingesta and a mass. The mass has a hyperechoic ventral surface indicating strong reflection of the ultrasound beam. There is also a large acoustic shadow, indicating a lack of deeper penetration of the ultrasound beam through the object. Ingesta moves from side to side around the object. The stomach seems to be contracting normally. This 11-year-old, 58-pound Rhodesian Ridgeback had presented with chronic vomiting, a 15-pound weight loss, and lethargy. Radiographs were inconclusive. After ultrasound, a large piece of plastic was surgically removed from the stomach. The green arrow shows ingesta inside of the ventral stomach. The arrow then shows a large acoustic shadow with an irregular ventral border. A large hairball was suspected in this 11-year-old, 12-pound cat, showing symptoms of anorexia and weight loss. Vomiting was not a symptom, and the patient was not dehydrated. Remember, the gastric groove can form a tube to pass liquids directly to the pylorus. In this case, the gastric groove allowed liquids to bypass the hairball. The stomach wall appeared normal. The patient returned to normal after a large hairball was surgically removed from the stomach. This video is from a 9-year-old Labrador weighing 104 pounds and showing acute symptoms of projectile vomiting after drinking large amounts of water. Note the hypermotility of the fluid-filled stomach in this transverse view. The stomach is followed to the pylorus on the patient's right side of the abdomen, where a large circular object is seen. A ball foreign body was suspected, and a superball was removed from the stomach by surgery. Note that this ball does not contain air and does not show an acoustic shadow. If air was present, the ball would have a hyperechoic, rounded surface and a large gas artifact or acoustic shadow distal to the ventral surface. This video is from a 2-year-old Chihuahua that has been vomiting food and bile for a week. Ingesta is seen in the stomach, followed by an acoustic shadow with an irregular surface. A cloth foreign body was suspected because the surface of the foreign body was not hyperechoic. The ultrasound beam was not being reflected. It was completely absorbed. A child's sock was surgically removed from the stomach. Here is another example of a cloth foreign body of the stomach. There is a large acoustic shadow without a highly reflective ventral surface. Do you notice the hyperechoic fat in the abdomen? There is also a moderately echogenic abdominal effusion resulting from septic peritonitis due to gastrointestinal perforation. This patient was euthanized.